Hello Medicos and welcome back to my channel once again. If you really like this video, please share it with your friends and subscribe to my channel. Hit the bell icon so you are the first one to get notified as soon as I upload any video. So today we are going to discuss Ophthalmia Neonatorum. Ophthalmia Neonatorum is a neonatal conjunctivitis. So how is it characterized by? It is characterized by bilateral inflammation of the conjunctiva occurring in an infant less than 30 days old. So bilateral inflammation signifies that it affects both the eyes, right? Now, do you think it is a preventable one? Yes, it is a preventable disease because it usually occurs as a result of carelessness at the time of birth. Now, as a matter of fact, any discharge or even watering from the eyes in the first week of life should arouse suspicion of ophthalmia neonatorum. Why? The reason is the tears are not formed till then. Okay. So, coming to the etiology now. When we talk about etiology, first let us know the source of infection and the mode of infection. So, the infection may occur in three ways, that is, before birth, during birth, or after birth. Before birth, it is very rare and it is through the infected liquor amni in mothers who have undergone rupture of membranes. Okay. Whereas during birth, what happens? During birth is the most common. How? Through your infected birth canal. If the mother is infected, then when the baby is being born, through her infected birth canal, especially when the baby is born by a face presentation. Okay. Face presentation or with forceps delivery. Now, after birth, how does it occur after birth? After birth, infection may occur during the first bath of newborn or from soiled clothes or fingers with infected lochia. Okay. Now, what are the causative agents? The causative agents can be either a simple chemical conjunctivitis or gonococci or other bacterial infections or neonatal inclusion conjunctivitis or herpes simplex ophthalmia neonatorum. Okay. Now, chemical conjunctivitis. How does this happen? It is caused by silver nitrate or the antibiotics which are used for prophylaxis of ophthalmia neonatorum. Okay. So, it is a self-limiting one and it usually disappears by itself. Then, how does gonococcal infection occurs? Earlier in the past era, it was considered as a very dangerous or a serious disease because it was responsible for 50% of the blindness in children. But recently, we have seen that there is quite a decline in the incidence of gonorrhea, as well as effective methods of prophylaxis and treatment which we are following have almost eliminated it in developed countries. However, in developing countries, we still come across these cases and it is a problem. So, appropriate measures should be taken. Now, what is neonatal inclusion conjunctivitis? Neonatal inclusion conjunctivitis, you have already learned in the last lecture, chlamydia trachomatis causing trachoma. If you remember the classification of chlamydia, then D2K serotypes of chlamydia trachomatis was responsible for neonatal inclusion conjunctivitis, right? Then what are the other bacterial infections that can cause them? Apart from gonorrhea, they are the Staphylococcus aureus, the Streptococcus hemolyticus and the Streptococcus pneumoniae. How about the viral cause? It is nothing but the herpes simplex ophthalmia neonatorum, which is caused by herpes simplex 2. It is also rare. Okay. So, herpes simplex, if you remember from your microbiology, herpes simplex 1 is responsible for above the waist infections and herpes simplex 2 is below the waist. So, when the mother is having a vaginal infection of herpes simplex 2, this is vertically transmitted to the fetus and herpes simplex 2 will cause ophthalmia neonatorum in the newborn. Okay, so this is an exception. Now, this can remain dormant in the ganglia for years together in the newborn. As a matter of fact, herpes simplex 2 infection in mother is an indication for a cesarean section. Do not go for a normal delivery in cases where the mothers are infected with herpes simplex 2. Okay. Now coming to the clinical features. When we come into the clinical features, let us know about the incubation period of the different causative agents. So it varies depending on the type of causative agents. Now, different textbooks have given different incubation periods for different causative agents. So, whichever textbook you follow, make sure that you are writing the same thing. Okay, have confidence in yourself. Now, the chemical agent or the chemical conjunctivitis, the incubation period is the first 24 hours of life. In first 24 hours also, first 4 to 6 hours are very important. Okay. Coming to the second one, which is the gonococcal, it is 2 to 5 days. Other bacteria like staph strepto, they incubate for about 5 to 7 days. Chlamydia trachomatis D to K serotypes is for 5 to 14 days, whereas herpes simplex is 7 to 14 days. So these are the different incubation periods of different causative agents. Let's learn about the symptoms and the signs now. So what you observe is the discharge. The mother usually complains that the baby is having discharge from the eyes or tears from the eyes. Because a baby cannot complain, when you observe carefully, you can see that the conjunctival discharge is present. Depending upon the causative agents, the conjunctival discharge differs. If you see gonococcal, it will be purulent, whereas in others it will be mucoid or mucopurulent. Observe this figure here. The lids of the baby are swollen. Because of all this, there will be swollen eyelids which leads to pain. So there will be pain and tenderness in the eyeball. Now the conjunctiva, if the eye is open, the discharge cleaned, and then look for the conjunctiva, you can see it is hyperemic and chemosis is there. How about the cornea? Corneal involvement is actually rare, and it may occur in the form of superficial punctate keratitis in herpes simplex virus. Okay. What are the complications? Untreated cases, especially when it is gonococcal ophthalmia neonatorum, it develops corneal ulceration. Now this ulceration perforates rapidly and results in corneal opacification or staphyloma formation. So these are the complications of an untreated gonococcal ophthalmia neonatorum. Now, if I have to summarize all this, I'll summarize it as if the etiology is chemical agent, first 24 hours of life is the time of onset, then the clinical presentation there will be very mild edema, mild serous discharge only. Self-limiting it is and will last for 2 to 4 days. What are the ocular complications? None as such. Then systemic complications also we don't have any. Whereas chlamydia trachomatis, the time of onset will be 5 to 14 days and the lid swelling varies. There's a different degree of lid swelling. How about the discharge? The discharge is mild to moderate, serous or purulent. And conjunctival hyperemia will be more pronounced on palpebral conjunctiva. What are the complications then? If you see the ocular complications, you'll see that if it is a chronic infection, it causes corneal scarring, pannus formation and symblepharon. Whereas the systemic complications is it causes pharyngeal colonization and leads to pneumonia or otitis media. Then how about if the Neisseria gonorrhoeae is the etiology? Then the time of onset will be 2 to 5 days approximately, and it is hyperacute in onset with severe lid swelling, chemosis, copious purulent discharge. The complication, as I already mentioned, is ulceration, corneal perforation, staphyloma formation, and ophthalmitis may occur within 24 hours. Then coming to the systemic complication, it can be bacteremia, sepsis, meningitis, arthritis, and the death of the baby. How about bacterial, other bacterial like staph and strepto? The incubation period will be 5 to 7 days. It is subacute course, variable presentation depending on the type of bacteria, if it is staph or strepto. The lid swelling will have, there will be a lid swelling with purulent discharge. Now, how about ocular complications? Apart from staph and strepto, if it is the Pseudomonas species, it causes corneal ulcer, corneal perforation, and endophthalmitis. It won't have any systemic complication. Coming to the herpes simplex virus. Herpes simplex virus, the time of onset will be 7 to 14 days. Then, if you see clinical presentation, it presents with mild conjunctival hyperemia, serosanguinous discharge, corneal epithelial defects, and possible vesicular eyelid rashes. Recurrences may cause corneal scarring and profound amblyopia, chorioretinitis, optic neuritis, and cataracts. How about the systemic complication? Meningitis, disseminated central nervous system disease with mortality rate up to 85%. So all this is a summary. Even if you don't remember it, no problem. You just have to know about the etiology, the time of onset, okay, and the symptoms and signs. Coming to the treatment now. Prophylactic treatment is always better than your curative treatment. So the prophylaxis includes antenatal, natal, and postnatal measures. Okay. Antenatal measure includes thorough care of mother and treatment of genital infections when suspected. Natal measures are of utmost importance. How? Because mostly infection occurs during childbirth. We already learned, right? So what you do is you will conduct the deliveries under hygienic conditions, or you say aseptic measures. Okay. Now, as soon as the baby is born, the newborn closed eyelids of the newborn are thoroughly cleansed and dried. Okay. How about the postnatal measures? Once the baby is born, you will give 1% tetracycline ointment or 0.5% erythromycin ointment or 1% silver nitrate solution into the eyes of babies immediately after birth. Or what you can do is you can give a single dose of injection ceftriaxone 50 mg per kg IM or IV to infants born to mothers with untreated gonococcal infection. Okay. I hope the prophylactic treatment is clear. How about the curative treatment now? See, as a rule, what you do is you always, for the diagnosis, take a conjunctival cytology sample and send it for culture and sensitivity. Okay, now you treat the case. How do you do the curative treatment? For the chemical ophthalmia neonatorum, we already know it is a self-limiting condition, so it does not require any treatment. How about the gonococcal ophthalmia neonatorum? It needs a very prompt treatment. So you can either treat it by topical therapy or by systemic therapy. Topical therapy, you will immediately give a saline lavage hourly till the discharge is eliminated. Then bacitracin ointment is given 4 times a day. Because of resistant strains, topical penicillin therapy is not reliable. Okay. Now, if cornea is involved, then atropine sulfate ointment should be given. How about the systemic therapy? Neonates born to mothers with gonococcal infection who are having gonococcal ophthalmia neonatorum now should be treated for 7 days with any one of the following systemic therapy. So 7 days treatment is your systemic therapy. What can you give? You can give either ceftriaxone 75 to 100 mg per kg per day IV or IM 4 times a day, or you can give cefotaxime 100 to 150 mg per kg per day IV or IM 2 times a day, and ciprofloxacin 10 to 20 mg per kg per day or norfloxacin 10 mg per kg per day. Or if the gonococcal isolate is proved to be susceptible to penicillin, crystalline benzyl penicillin, you can give 50,000 units to full term normal weight babies and 20,000 units to premature or low weight babies IM twice daily for 3 days. Okay. Now, how about other bacterial Ophthalmia neonatorum? These should also be treated with broad spectrum antibiotic drops and ointments for 2 weeks. So, 2 weeks is sufficient here. How about the neonatal inclusion conjunctivitis? This responds very well to topical tetracycline 1% or erythromycin eye ointment 4 times a day for 3 weeks. Okay. But you should give it along with the systemic erythromycin. How much? 125 mg orally QID. That means 4 times daily for 3 weeks. Now you should always treat both the parents with systemic erythromycin. How about the herpes simplex conjunctivitis? This is also self-limiting. So, because it is self-limiting, no specific treatment. However, sometimes topical antiviral drugs to control the infection more effectively will prevent the recurrence. We have seen that herpes simplex will stay dormant for a long time. So, chances of recurrence are high. So, however, we can give some topical antivirals. Okay. This was all about Ophthalmia neonatorum. I hope that concept is very clear. If you have any doubts, please mention it in the comment section. I'll try to clarify them. So, share it with your friends, subscribe to my channel, and see you in the next class.